We'll call the Homes Committee to order, and welcome to the Homes Committee meeting for October the 1st, 2015, and welcome to our online visitors. Just to be reminded that this meeting is being video recorded and live streamed and will be available for viewing on the County of Bruce website. Thank you for viewing. Any declaration of pecuniary interest stated now? There is none. We have no action committees, but we do have two information items for Bruce Lee Haven, and we'll do that first. Eleanor?
Okay, good afternoon. My report has been circulated, and I just specifically wanted to draw awareness to the Ministry of Health and Long-Term Care. I have added the public report from our inspection in July, which occurred on July 13th and lasted for 7 days. And the outcomes from that are listed in the report, one of which is an order related to infection control. I did include with the report the copy of our compliance plan that was submitted as required by September 30th, and the leadership team is working with the staff, residents, and others in the home to ensure that we are in compliance, because after October 30th we need to be prepared for a follow-up inspection. In addition to the order, we were issued 6 written notifications, and a written notification is an awareness of an observation that while during the inspection there was an observation that we were not in compliance with a component of the Long-Term Care Homes Act. The written notification number 1 with the infection control parallels the order. 1 is safe transferring of positioning devices or techniques were not used consistently with addressing residents. Number 3 related to nutrition care. Number 4 related to the zero tolerance for abuse policy. And what that one was is there was in the charting a statement that there might have been an alleged abuse incident during the investigation, and it wasn't investigated immediately, and it was reported to the Director of Care via email, so she never got to that email until the next day, at which time it was followed up and proven to be a non-issue. But regardless, we did not start the investigation as our policy said. The number 5 was related to pleasurable dining, and number 6, the safe storage of drugs. And for that one, that was related to, on one occasion, an inspector noticed a medication cart to be found unlocked. Despite a nurse being close by, it was not locked as was expected in our policy. So that was a written notification there. Are there any questions about the resident quality inspection?
What's the issue with patient transfers?
The issue, patient transfers, at the time, we have notices by the beds to remind our staff. Some people need one person to help them move, some people need 2, some people need a lift. And in this case, it was observed that the staff used, I believe, 1 person and the sign said 2. Yeah. So there is a bit of a theme in that our staff need to be sure that they're following the outlined expectations and policies, and you will find that when we talk about our business plan, that is one of our strategies for our upcoming year, is to have compliance with our policies and the Long-Term Care Home Act, and that's something we're going to be working on over the next year. And that is...
Any further questions? Yes, go ahead.
So when you say compliance, will that involve more staff? Because sometimes you're going to need to move a patient and you have to run and find somebody else, and sometimes it's really hard to meet requirements of every little thing that they're pointing out here.
It is definitely hard to make sure out of all. I think in Charlie's report he actually cited the number of regulations. I think he said it's in there. So as a licensee, we're responsible to have policies in place and to educate our staff to know what they're supposed to be doing. And then secondary to that, to support all that, it's also our responsibility to supervise and enforce it. And through our next year's planning, we're trying to draw awareness to the staff's responsibility and increase the surveying and the supervision. So there is no request for additional staff for that, but the demands of the staff are high to care for the residents as their acuity increases, for sure.
Go ahead, Mel.
Thank you, Mr. Chair. Eleanor, just on all of the policies that you have, do you have regular staff meetings to review those policies? I'm assuming probably you do.
We definitely have regular staff meetings. I have a general staff meeting, so when there's a home-wide policy, we talk about it there. We also have legislation that we have to review a number of policies annually, and we do that through our electronic surge learning. So policies like abuse is a mandatory one that we have to review every year, and that gets done. And then the policy books are so thick to review every one of them is challenging. And we do also, in our year of change and trying to make sure the staff know what to do and supervise it, we do have an overview of looking at how our policies have been divided and created. And we have, all of our staff are now qualified. So in years past, everything we asked our staff to do, we created a policy. So a very simple example is we probably have 3 or 4 policies on bathing residents. How to bathe them in the tub, how to bathe them at the bedside. And that came from years ago, hiring people without qualification, so we needed to make sure they knew what the expectations were. Now we hire qualified people, so those day-to-day tasks that they are accountable to have through their training, like how to give a pill and how to give a needle and how to bath somebody, we don't need a policy on that because you can assume they come with that qualified training. And so we're looking to have a resource to them instead of this big, big book of policies. So that's all in this upcoming year of transition and change. But the big overarching home-wide policies, a number of them are mandated to be trained annually.
Okay, yeah. Okay, good, thank you.
Any other questions? No, there is not. Okay.
That's my report for Bruce Lee.
Okay. Okay, that was the full report for the Bruce Lee Haven, the Bruce Lee home. Charlie isn't here, so Eleanor's going to do the gateway for him.
So, a lot of pages in these reports. I just want to also do an overstatement that it is our responsibility to inform you of the outcome as our governing body of our inspection. So Charlie and I are doing that through this process. And we also post it publicly in the home, and it's been shared with our staff at general staff meetings. So Charlie's report is before you as well, and I just want to review or acknowledge that in his background, in his administrator's report, he references the resident quality inspection which occurred at Gateway Haven in August, but I would like to defer conversation on this because it is noted that inadvertently the report from the public report is from last year and not the current report. So we'll just defer that till Charlie returns, and then the 2 reports will parallel each other. And there's nothing else in his report.
Is there any questions? Okay. Oh, go ahead, Mike.
So when they do these, by the looks of it, there's 3 inspectors that are there for an entire week?
Ours were there for 7 days.
7 days.
Charlie had more, I think. He August 4th to the 14th.
10 days. Wow.
And how it starts is they interview 40 residents, and staff, family, and residence council members. And I think what's important for you to know, and it's very, very impressive, is from those interviews with the residents, family, and staff, nothing was triggered to follow up into a secondary inspection. So the rest came through what they have to look deeper into and what was triggered while they were out walking around and seeing the home. And that makes sense because if you go back to our resident satisfaction surveys, they're quite high.
Any further questions? Okay, there is none. Okay, those reports were for information purposes. And now that we adjourn at 1 p.m. to meet again on November the 5th. I need a mover and a seconder. Moved by Ann, second by Paul. All in favor? Carried.
Thank you.
Now adjourned. Yeah.
Good, how are you? Let me get into this one here. I'd like to call the committee of the museum to order. If anybody has a pecuniary interest, please declare it now or later as the agenda arises. And we have no action items, but we do have 4 information items, starting with the archives report.
Well, good afternoon, everyone. I just wanted to start off with the archives update report. And the first item on there is in regards to our Bruce Remembers website. And some of you will recall this website was, it was an initial project through the library and created back in 2007 through a grant. And the museum has kind of been participating with library, and we've taken ownership of this website because, as you can appreciate, once a website gets up and running, that's not the end of it, right? It needs to be kept fresh and updated. And there was a great need for us in regards to the Bruce Remembers exhibit that we were putting forward in commemoration of the 100th anniversary of World War I to be more inclusive and have a better web presence when we're talking about military. And of course, we had our own website, a military website as well. So we've kind of taken the 2 websites together, and we've created what we think is a very good resource from a historical perspective, but also from a research perspective. So we did the initial soft launch of the Bruce Remembers website back on June 20th with the exhibit opening. And we've been tweaking it as we go. Primarily right now, there's a lot of information pertaining to archival documents and research from that perspective, and we are adding in the collection side as well. So we will be looking to launch this mid-October, but really closer to the November timeframe in conjunction with our Remembrance Day program. So I'm not sure if I can link to that right now, but let's just see here quickly if I could do that. And I'll just give you a little bit of an idea of the look and the feel of it. And I don't know if it'll, maybe it's not connecting. No, I don't know if it's going to connect right away. Yeah, it's not. Anybody got an IT person here? No, just kidding. So I don't know. maybe it's not on connecting through the server here because it's still in test. So at this point, what we will do is we will provide a current link that you can have a look at it. But like I said, quite a lot of work has gone into it, and I think it's going to be a very good resource for us on a long-term basis, and then also from a research perspective as well. Many of you, again, are familiar with the Krug donation that had come into us back in 2013. So the Archives Department has been working in conjunction with some volunteers as well at the museum to start cataloging and processing this collection. And what's a really important milestone for us right now, there was approximately 1,600 postcards in the collection, and these cards have all, over half of them have been they have been digitized and described in past perfect. And once again, it's a matter of us making the material accessible, right? So that's a really important part of that. And there's quite an interest in the Krug collection, so we continue to work at that to make sure that we have people have access to that. So there's just a couple of snapshots of some of the some of the great postcards that were in the 1,600 that we got. Moving into the education and outreach aspect. Just a couple of things to wrap up from our summer months. Obviously, the Kids Zone Camp, we had lots of interest and kids from all over to the area, so that was a very successful program that ran this past summer. We're also looking at some upcoming events. The Night at the Museum is one. And just in regards to the situation on the education front, as you know, we are in a situation with the elementary school board that we're not really seeing any movement forward in terms of school trips. We're hoping that as things progress, we will see a change in that, but at this point in time, it's not actively being, teachers are not actively coming to us for programming. That said, we have worked in creating a new guide. So we're ready for when the teachers are ready at the elementary level, and we are proactively working through the Bruce Grey Catholic Board, as well as any of the homeschool groups that we have, and also at the secondary level, because the secondary level, of course, they've already signed the contract. So we have Andrew Robertshaw coming back to do some programming again at the high school level. The grade 10 curriculum links nicely with the in regards to the First World War. So he will be coming in October 22nd, and we'll be doing some programming around that as well. So we continue to provide service there as well. Into the marketing report, so Shannon has done an extensive kind of wrap-up of our summer activities. We still progress with our coupons. There's a little slight increase in the number of coupons, coupon redemption over the summer. So we are seeing that people are still looking to have some sort of value or savings. So we'll anticipate to carry that into next year. As mentioned in a previous committee meeting, we did see a slight, a decrease in terms of paid attendance, but our membership revenues are increasing, which is great because we are seeing that focus in terms of seasonal residents and other individuals who are taking out membership because they obviously see it as a cost savings and a great way to come back to the museum and utilize the facility over and over. In terms of where guests are coming from, we are initiating now a postal code capture. So it's important for us to realize where our visitors are coming from. Membership gives us that demographic already, but when someone who's just coming in on a one-day visit, we really want to see where people are coming from. And this will help to guide in some of the marketing that we do, whether it's advertising or promotional activities. So there's kind of two snapshots there. Not surprising that we're still seeing a great number from the GTA as people are coming up either seasonally or one-day or week visits, but a good number throughout the county as well. So it's kind of a snapshot of where we're at. The surveys as well, this is something that we're going to be working with IT over the next little while to see how we can capture surveys and recommendations from people in an online format. Currently, we are doing it in a paper-based format, and as you can imagine, that can be time-consuming from a resource perspective. So we're working with IT to move that process forward. But what we're seeing is, in general, the comments are good coming back. People are pleased with the services and the programming that we're providing. We joked a little bit this summer about our summer fun team. We had a summer fun team of one. It was one marketing student who was with us, and she was absolutely phenomenal. Did a great job for us. She worked in conjunction with, in particular, with the tourism staff on a lot of outreach activities. So where we couldn't make an event, they piggybacked off each other, which was great. And she was at over 30 spots, I guess, that she had traveled throughout the county and extensively throughout the entire county, which was a big focus for her. Social media and website, obviously, two other tools that we're using for engagement as well as accessibility and promoting ourselves outside of Saugeen Shores, which is also very important. And we're seeing the website stats are comparable to last year, but an increase on the social media side, which is something that we had anticipated because the audience level is changing when we're changing into that 30 to 50 range, family oriented. Those individuals are very much mobile, very much on social media and interacting. So we'll continue to focus our efforts around there. And then getting into programming, just kind of a little bit of, again, of a recap in regards to some of the summer activities now that we fully got our numbers from the end of August. So lots of programming that had happened, some of the reptiles, the First Nations programming in there, the Special Guest Wednesdays, which we engaged with a number of different partners at that level, which was really fantastic. Partnering again with OPG to bring the Earth Rangers program, which is a program that is sponsored 100% by OPG. We are the beneficiaries of that program. One thing that was really great for us to see was the return of the Women's Institute coming back and actually doing programming out at the schoolhouse and the log home this summer. They had initially been very involved with the museum and various levels. The different groups are, some have disbanded, some have joined with others. So it was really great for us to engage with them and get them back on the museum grounds and assisting with us. And another interesting note was one of our other summer students this year, through a grant on the Young Canada Work side. She is actually pursuing a career in museum studies. So it was great for her to be present and to be active in all of the programming, and she did a wonderful job while she was there. Just a recap on the volunteer appreciation event where a couple of members were present. We had roughly, I think the big thing here is, we have a number of active volunteers, approximately 77 in total, but the amount of collective hours that they put their time in at the museum is astounding, with over, close to 5,500 hours at the museum. And there's just another picture of some of them, not all of them. Upcoming events, actually tonight is the museum mixer at the museum, and we're partnering with the Southampton Art School and a local brewery to pull off that event. And then we're into our fall programming schedule. So we have our Great War film series, a family event in regards to commemoration for the First World War, the Bala Bunch in partnership with Hampton Court, Scotch tasting, Rocky Horror, and a play that's coming up. So as you can see, there's another full schedule for the fall time frame as well. So,
thank you, Kathy. Are there any questions regarding any of these reports? All right, our next meeting is November the 5th, and can I have a motion to adjourn? Bob, and seconded by David. All in favor? Thank you, we're adjourned. Thank you, Kathy.
Thank you.
Probably, eh? I don't even know what it is. The Bala Bunch, they're really good musicians. Oh, I see. Where are they from? Teeswa. Yeah, they're really good. good singers, play all sorts of instruments, dance. I'm going to call to order the Social Services and Housing Committee meeting, and it's October 1st, 2015. Does anybody have a declaration of pecuniary interest? Seeing none, we'll go to our action item, which is an investment in affordable housing extension reallocation of secondary suite funding. And let Christine take over.
Thank you. Good afternoon. So the report that I have before you, we're just requesting an between-year switch in where we're focusing the dollars. So we had hoped that we would move forward with a pilot project on secondary suites this fall. And unfortunately, the projects that are showing interest in it won't be ground ready until 2016. So what we'd like to do is move ahead with spending in home repairs. We do have a wait list of households that are ready to go on home repair. And so we would spend that $50,000 this fall on home repair. And then in 2016, we would work towards the secondary suite pilot. And I can take any questions if you have them.
Yes, Rob.
You say there's $50,000 that's available for people to do home repairs, and you have quite a waiting list for people to be on this. How do you determine who gets it and who doesn't get it?
So the way that we've been managing the wait list is chronologically. So as the applications come in, if you're eligible, the application is date stamped, and then we move forward for as long as the funds are available.
Any other questions or comments? Moved by Mitch. The recommendation before you there, we're voting on it. So we have a mover and a seconder. Need a seconder. Dave. And any further questions or comments on the recommendation? All in favor? Any opposed? That carried. So our next meeting is November 5th, 2015. I get off easy today. Thank you. We need a motion to adjourn. Moved by Milt, second by Janice. All in favor? And that carried.
I'd like to call to order this Emergency Services Committee, and the first order of business is a declaration of pecuniary interest, and I'll remind you of your responsibility to do so. None declared. Then we have one information item. It's facility lease update.
Okay, I thought it was time that I come in and update you on the current state of our facility leases across the county, just to bring you up to speed on where we're at. And we have 2 leases that are expiring at the end of October, on October 31st this year. And they are with both hospital corporations, with South Bruce Gray Health Center for the Chesley Ambulance Station, and they're for the Grey Bruce Health Services for the Wyerton Station. And we've been in communication with both of them. And I'm anticipating coming back with a report at some point recommending the leases be renewed. Hopefully, it'll be at very minimal cost, so I'll let you know at that time. Right now, we currently have 6 ambulance stations in the County of Bruce. One in the municipality of Brockton, one in Erin Elderslie, one in Kincardine, one in Saugeen Shores, South Bruce Peninsula, and Tobermory. So I'll start off with Walkerton. It consists of 4,800 square feet, and the lease is a 10-year lease. It expires in 2022, and the total rent we're paying right there now is $40,356 a year, and with that square footage, that's pretty good. And the next one is the South Bruce Grey Health Center, and this is the one in Chesley. And as I said, it expires on October 31st, and we're currently paying $18,527 a year, and that amounts to basically $9.24 a square foot. And in Kincardine, the station's owned by MacArthur Management Services. It's 2,196 square feet, and in this one, it's a 10-year lease, and it expires on October 31st, 2017. Cost per square foot there is $19.50, and we're currently paying $42,826 a year. And I should point out that MacArthur Management Services provides all the maintenance on this station. We pay for nothing in this station. He pays the entire shot. That's grass cutting, everything. So moving on, in Port Elgin, this station is owned by Mr. Joseph Wyson. It contains 1,835 square feet, and for it, we currently pay $31,293 per annum. And I should point out, in this station, we pay all the maintenance costs and even the municipal taxes. And it is also basically the oldest station we have, and it's really starting to show its age. And the next one is Town of South Bruce Peninsula in Wyerton, and this is owned by Grey Bruce Health Services. And this is I would say, arguably the nicest station we have. It's on hospital property up there for anyone that's seen it. It's quite a nice looking facility. And it has 2,904 square feet. And as I say, it's expiring at the end of this month. And we have been talking to Grey Bruce Health Services about renewing this lease. And we're currently paying $20,833 per annum for that lease. And the municipality of Northern Bruce Peninsula in Tobermory, we own that facility, and we're paying $18,000 a year for it, and it's 1,600 square feet. And as I say, the Wyerton and Chesley leases are expiring at the end of the month, and I hope to be able to come back relatively soon with recommendations for renewing those leases.
Thank you, Doug. Is there any questions or comments from the committee? If not, then that's the end of our agenda, and I need a motion to adjourn. Ann and Janice, all in favor? We're adjourned. Thanks, Doug.
Okay, I'd like to call the Corporation of County Bruce Corporate Services Committee Human Resources Division to order. And just a reminder that this meeting is being video recorded and live streamed and will be available for viewing on the County of Bruce website. So thank you for viewing. Declaration of pecuniary interest. Is there any at this time or further down the agenda? Hearing none, moving on to information item. Mary Ann.
Thank you very much. So I'm here today to present a report to you on the Ontario Retirement Pension Plan, commonly referred to as the ORPP. So you've probably heard the news information on this particular piece of legislation. And so subject to legislative approval, by January 1, 2020, every employee in Ontario will be part of either the Ontario Retirement Pension Plan or a comparable workplace pension plan. The ORPP is structured to be an addition to the Canada Pension Plan, which is already in place. The ORPP will be subject to cost inflation with benefits paid out starting in 2022. Under the current framework, OMERS will be deemed to be a comparable plan, and therefore current staff who are enrolled in OMERS will not be affected by ORPP. However, staff who are not enrolled in the OMERS plan, including part-time and non-continuous full-time, will be enrolled effective January 1, 2020, which is the wave 4, employers with registered plans that do not meet the test. At that time, staff will be required to enroll in, if they're eligible, in either the OMERS or a comparable plan or ORPP. For eligible employers, enrollment into the ORPP will be phased over 3 years from January 2017 to January 2020. In 2020, both employers and the employees between the ages of 18 and 70 will make contributions of 1.9% to a maximum salary currently at $90,000 per annum. The projected financial impact of this for the County of Bruce is $51,000.
Thank you, Mary Ann. Questions? Will this include counselors starting in 2020?
Through you, Your Worship, that's a very good question, and I think we'll have to research it. I'm not, as an elected official who is also on payroll.
Any other questions? Okay, we will move into closed to discuss. Can you just roll that up a little bit? Personnel matters pursuant to Section 239(2)B of the Municipal Act. Do I have a mover and a seconder? Moved by Milt, seconded by Mike. All those in favor?